At the end of this month, Metro Health's psychiatric emergency department in Cleveland Heights will be closing. It was a change announced in October.
Metro's behavioral health hospital next door remains open. Metro says anybody in crisis should always be taken to the closest ER for help. The News 5 investigators recently discovered long wait times in local ERs, especially for those suffering from mental health issues.
The Psych ED at Metro opened in 2024 following the closure of the Psychiatric Emergency Services Unit at St. Vincent Charity Community Health Center. Well, next year, similar services will be returning to that campus with the hope of saving time, money, and lives.
We need more support. We don't need less.
I talked with a Cleveland woman wanting to advocate for people with mental illness, but asking not to show her face or name.
It's not just my journey. It's my entire family's journey, and it's specifically my brother's journey, and I want to be respectful of that.
Her brother has schizophrenia.
He's a great guy. He's a really fantastic person, and he's caring.
But it can be tough, she says.
Like, it literally took one of my brother's counselors to sit down with me and just say, look, the way that your brother processes through information is different.
The good times are good, she says, which are most of the time, but the bad are very bad and can happen quickly.
The illness is the biggest stressor because there's, relapses, if you will, flare-ups.
And it's in those times of immediate crisis she believes improvements can be made.
We need folks who know how to de-escalate. We need folks who know how to read the situation very quickly and help to get to a place of level.
Who is this for?
This is for anyone who's in a behavioral health crisis.
Eric Morse is the president and CEO of the Centers, the nonprofit that's partnering with Cuyahoga County and its Adams Board to build a new $28 million behavioral health crisis center, set to open in September.
You're going to be assessed within 5 minutes of walking in the door.
It'll be housed in this 3-story medical building being remodeled on the old St. Vincent Charity Medical Center campus in Cleveland's Central neighborhood. It'll provide urgent mental health and addiction care for an estimated 12,000 adults a year.
Though we will have medical staff there 24/7, we'll have, psychiatric providers, psychiatrists, nurses, social workers. Most of the staff are actually peer support workers.
Keeping people in community is important, says Morse.
So these are all the lounge chairs.
The first floor will be a 40-chair crisis recovery center and walk-in behavioral health urgent care with a pharmacy. He says the goal is to reduce the need for ER visits, jail bookings, and psychiatric hospitalizations.
Someone walking into our center will cost approximately half of what it costs for them to go to an emergency room.
The second floor will offer residential level of care, and the third floor will be outpatient with a clinic.
We can solve this problem if we just bring the right tools to bear to help people recover, to help them get back to work, to help them get back to their families, and to stop their suffering.
Ohio has been working to build out its crisis continuum, a priority of Governor DeWine's, using millions in American Rescue Plan Act funds to help counties strengthen mental health and addiction services. We were there when the Lorain County Crisis Recovery Center opened its doors in October, and I recently followed up.
What's been the biggest surprise?
The numbers served in the first 30 days. I didn't see that coming.
Director of the Mental Health Addiction and Recovery Services Board of Lorain County, Michael Dowd, says they served 200 unduplicated clients in the first month. He says it speaks to the need in the community.
What do you think the people who live in Cuyahoga County need to know about this? What do you want to tell them with what you've experienced here in Lorain County?
It works.
This Cleveland sister tells me she's hopeful, not just for her brother, but for all families dealing with a behavioral health crisis.
Because it's stressful. It's stressful. We love our brother. He's valuable to us. He's a valued member of our family, and we believe he's a valued member of our community. So having this kind of space, this place, to be able to help him be the best that he can be is incredible.
Now, funding for that new behavioral health crisis center comes from a combination of sources, including the Adams Board, ARPA dollars, and the county's opioid settlement fund.
So while the need and the demand has not gone down, the money has gone down.
Specifically heading into next year, so we wanted to look at that. Yes, Cuyahoga County has tightened its budget, so that means less money for the Adams Board, which uses its budget to fund about 200 programs within more than 70 agencies that provide behavioral health services across the county, like the private nonprofit agency Frontline Service. How much of a reduction did you have to adjust to?
The agency lost about $1 million in funding, and most of that is in the crisis programs.
Rick Oliver is Frontline's Director of Crisis Services. He says for them, the 20% reduction in funding they receive from the Adams Board has resulted in 8 layoffs and 4 positions left unfilled, including at their call center. They also discontinued a program that followed up with people who had been recommended services. He says it's difficult. Behavioral health providers are being stretched and finding ways to make sure people do not fall through the cracks.
And so we're trying to let people know that our services are available, our crisis services are available. They are free, and calling in for help is at least our staff can help direct people to services that are available.
He encourages anyone with questions or experiencing a behavioral health crisis to call them at 988. He says they get about 180 calls a day to the hotline, many for depression, anxiety, or suicidal thoughts. He says 90% are helped over the phone, 10% need more services. Frontline will send out a licensed clinician and a peer to do an assessment and help connect people to resources. So again, 988 if you or someone you know is in need of immediate care.